So we've already briefly spoken about in previous videos the symptoms of menopause, but given that this will likely be the main thing impacting your day-to-day life if you're going through these transitions, we wanted to spend a little bit more time exploring the individual symptoms in a bit more detail, so breaking them down one by one, looking at the symptoms, why they happen, and what, if anything, we can do to help improve these. So hot flushes, night sweats and palpitations are what are commonly referred to as vasomotor symptoms. They're really, really common and are experienced by around about 75% of people. And 1/3 of those will have severe symptoms with this, so significantly impacting their life. And the symptoms they typically present themselves just a few years before going through the menopause, and they can persist for around 7 years commonly. In around about 20% of women, they can continue for up to 15 years following menopause. So, given that for a good proportion of women, these symptoms may go on for a really significant period of time, it's so important that we help manage them where they are having impacts on our physical and mental health in particular. For many, hot flushes can have a significant impact on sleep, often causing waking at night from the sweats or the palpitations. And then that lack of sleep can then have a consequent knock-on effect to mood, symptoms and concerns and worry around the ability to function the next day. These symptoms can also feel very uncontrollable and visible to those that are around you, and can significantly undermine confidence and self-esteem, especially in that professional setting of a workplace with what feels like a very personal and private matter seemingly on display for everybody to see. So I think it can be really helpful to understand why hot flushes and night sweat symptoms arise in the first place. So with an altered level of estrogen in menopause, there's a shift in what is known as the thermoregulatory zone. And this is an area of our brain that identifies what temperature our body is and then responds accordingly to cool us down by dilating our blood vessels, causing flushing and sweats when it senses we are too hot, and then shivering when it feels that we are too cold. In menopause, this thermoregulatory zone narrows so that there is a much smaller window in which it responds, it causes our body to respond to cool us down when it's actually not really necessary. So you may notice that drinking alcohol, eating spicy foods, or being in a rush triggers these responses. And having this understanding can be very useful in managing these symptoms and reframing things. So pharmaceutical treatments in the form of hormone replacement therapy, or HRT, can be very, very effective in diminishing the frequency and the severity of hot flushes, completely eliminating them in many cases. Also, cognitive behavioural therapy for menopause has really good evidence to support the management of hot flushes, and learning the strategies that go with this can be hugely beneficial, significantly reducing the impact of hot flushes in a long-term way. If you are unable to take HRT, for example, if you've had a previous diagnosis of breast cancer, or you carry a high-risk hereditable gene for breast cancer or ovarian cancer, HRT may not be an option for you. And in this case, although HRT is limited, there are other medications that have been shown to help, such as a type of medication commonly used as an antidepressant, an SSRI and an SNRI. These are just a class of antidepressant that we use, and studies have shown that the short-term control of vasomotor symptoms is improved, but some may also experience unpleasant side effects such as dry mouth and loss of libido. As well as this, there are a number of herbal supplements that can be considered helpful, but there is limited data to support improvement in hot flush symptoms. So we'll cover the more herbal alternative options in more detail in a separate video if you're interested. Many women will also experience heightened mood changes, with anxiety, low mood and irritability or anger being really common. If you're still having a period, these may happen in the week or two leading up to your period, the luteal phase, when your natural progesterone levels tend to be a little bit higher. Or it may be exacerbated because you're not sleeping very well. HRT for perimenopausal women with mild to moderate symptoms of depression and anxiety can be very helpful and is considered first-line treatment for these symptoms due to menopause. For those with severe depression, antidepressants are often recommended as a more effective method of controlling them. And then herbal options, again, we talked about briefly before, but such as St. John's wort and Agnus castus can also be really helpful, but they've got mixed evidence to support their use. And it's also really important to remember that these aren't benign treatments, and if you are having other medical conditions or you're on other medication, you should really check with your treating physician before taking these, because there can be interactions. So it's important to note that this is a really difficult time of life with the many challenges and responsibilities that come with it. So while medications can be helpful to manage symptoms, it's also important to look at other lifestyle factors playing a part in these symptoms and try to employ strategies to help manage these better. Many women report difficulty concentrating, so issues with cognition, memory problems, brain fog symptoms, and this can be really troubling, especially when manifesting during our working life or when finding you forget words mid-sentence. This is thought to be as a result of lowered estrogen levels. Observational data suggests that HRT can also be helpful for the symptoms, but it is thought that this may be by improving some of the other symptoms like the sleep issues and the hot flush issues that are impacting issues around cognition. So this is another symptom which can be compounded by poor sleep, so taking steps to improve sleep hygiene can also help. Joint aches and pains, particularly in small joints such as hands and feet, are caused by falling estrogen levels, which normally acts to lubricate joints and keep other tissues supple. HRT can be very beneficial to those suffering with often very impactful pain and stiffness during menopause. And it's important to say here that other lifestyle factors, again, such as weight loss, diet and exercise, in particular stretching activities like yoga, are really important to help mobility. Our muscles strength and the mass also declines during menopause, and it's really important to maintain our stability as we get older. But our muscles also act on our bones by putting tension through them and helping strengthen them too when we do strength training activities. So it's recommended that we do around 2 to 3 episodes of resistant weight loading exercises each week to maintain that. There are a group of symptoms referred to as genitourinary symptoms of menopause, or GSM. All this means is you may experience symptoms of vaginal dryness or soreness, pain during intercourse, and worsening of incontinence, often with increased urinary infections. It's thought that around 50% of women, so half of women, suffering with these symptoms during menopause, and only 25% of those will then seek help. This happens because the superficial cells that line the vagina and vulva reduce by around about 90%, and this ultimately leads to a reduced collagen, which causes thinning and more sensitivity in the tissues of the genital area. The symptoms are very treatable, so we can use vaginal moisturizers and lubricants, which are a great option. Also, local replacement with low-dose estrogen creams and pessaries can replace the missing estrogen and help sort of plump up the tissues again. It normally helps these symptoms really significantly, but it can take around 6 months for vaginal estrogen to have an effect. It's important to mention here that these types of topical estrogen are not the same as the systemic HRT that you take in patches or gels. They are very locally acting and have been shown to be safe to use for those who have breast cancer or who can't have other types of HRT. It can be incredibly upsetting to experience symptoms of loss of libido and have an impact on your relationship at a time when you may be struggling with changing roles and identity as you move into this next phase of life. Low estrogen levels can impact sexual arousal, which can then have a significant impact on relationships. However, sexual desire is multifactorial, and although drop in estrogen and testosterone levels may impact it, it's important to look at other reasons too. So exploring difficulties and stresses in relationships and considering psychosexual counselling, which can be very helpful. Estrogen replacement can often help with libido symptoms, but there is no improvement. Then the option to use off-licensed testosterone is one that can be explored. And we'll talk about this a little bit more in another video on testosterone. So do check that out if it's something that you are interested in.